Now, doing pretty good. This is the key slide. I don't care if you didn't take any notes anywhere else. Mark this slide, highlight it, take it out, blow it up, put it on your window mirror, put it in your rearview mirror. This is the key to medicine. This statement from Spiroff. This is why I know he supports bioidentical hormone replacement. From this statement. And it says, the ultimate biological response reflects the balance of actions of the different hormones with their respective receptors. Everybody in here, if you're involved in healthcare, you want your patients or clients to have the ultimate biological response. Can we all agree upon that? Okay? I think that's universal. You want your patients to have the ultimate biological response. Spiroff says in order to do that, you got to balance the action of the different hormones with their respective receptors. So in order, if this is our goal, let's work backwards. Receptors. What kind of receptors do I have? Do I have Provera receptors? Do I have receptors for all those compounds with those triple bonds and that Y thing on it? Do I have receptors for that? Do I have receptors for horse urine? Okay, so if I don't have, what do I have receptors for? I have receptors for the hormones that are in that steroid pathway, correct? Everything that's in that steroid pathway, I got a receptor for, because that's the original equipment, right? So if I want the ultimate biological response, the first thing I have to do is to use the hormones that I have receptors for. What kind of hormones would those be? So-called bioidentical hormones would be, if I want the ultimate biological response, I better use the hormones that I have receptors for. And can I just use them willy-nilly? Just say, wow, this is the natural hormone here. Take a bucket full of it, bathe in it, eat it, put a suppository in, do whatever you want to with it. I can't do that, because Spiroff says, I got to balance the action of it. Now, where is the action taking place?
In the cell.
It's in the cell. So it didn't say balance the serum level, which is the transport. See, blood is a transport system. It's like a train or a bus or whatever. I don't have my effect on the train or the plane. I took a plane here for 1 hour. That's all I was, an hour and 20 minutes. I had to get off of the plane and come here and do a seminar. That's where the what? That's where the action is here. Okay? So I got to balance it where the action is. So I got to balance it at the what level? Cellular level. What gives me a window into the cell? Saliva. The saliva. So I got to balance that. And don't get mad at me. Who said this? Page 61. So what did I do in my residency? Let me tell you what I learned. I learned to use hormones that I don't have receptors for, and you don't need to measure nothing. So I'm from the South. In the South, if you want to make a point, you have to use a double negative, and that's what I'm trying to do, okay? I know that was a double negative. You don't need to balance nothing, because I go by symptoms. Isn't that what we said? I don't measure hormones, I go by symptoms. Let's say we did that with potassium. Potassium can't hurt you, can it? It's natural. Well, but I don't like to measure potassium. I like to go by symptoms. So you come in with a leg cramp, or you got hypokalemia. Well, doc, you want to take a level on that? No. I go by symptoms. Well, we're going to give you 40 milliequivalents of potassium. Well, I need to come back in a couple of weeks, right? No, I go by symptoms. You say, well, doc, what kind of symptoms should I be looking for? You say, you ever heard of a cardiac arrhythmia? It's why they have those defibrillators in the airport. And I would suggest you invest in one of those. And you have it around and put a big sign on your neck. If you see me, like unconscious, please defibrillate me. And if that happens, when you come back, I'll lower the dose, because I go by symptoms. Now, everybody laughs at that and says, oh, doc, you just, patient comes in and says, I'm having hot flashes. Oh, you got estrogen deficiency. You need some Premarin. Okay, doc, you're going to take my Premarin level so you make sure it's low? What's the normal Premarin level? How low? Is it 1 per cc, whatever? Say, no, I go by symptoms. You say, doctor, do I need to come back and make sure I got the right? I told you I can't go by symptoms. So the patient comes back 6 months. She gained 20 pounds, breast tender. You say, well, hey, you just eating too many biscuits. I don't know why you gained all that weight in 6 months. You just need to go and do what I told you to do because I go by symptoms. Well, then the patient comes in and she said, well, I went to my family practice doc and I got a positive mammogram. And then what do we tell her to do with her Permirin then? Stop it. Is that any different than waiting until the cardiac arrhythmia to lower the potassium dose? Is there any difference there? So why is one comical and the other one, not only did we do it, we still do it. And it's accepted. Because everybody else is what? Is doing it. Okay, it's the standard of care, not because it's right, it's because everybody else is doing it. Okay? All right, so what we want to do is, I'm going to tell you, if you think of this every time a patient walks in the door, it says, if I want the ultimate biological response, I need to see what's out of balance, put it back in balance, and I might get the ultimate biological response if I use what the body has for original equipment. Okay? Now, we're going to start answering some questions. Okay? Because here's what we want to know. How do we use this clinically? So here's one of the questions. Does progesterone protect the endometrium? I'm sorry. Does progesterone protect the endometrium? Well, in general, progesterone antagonizes estrogen stimulation of proliferation and metabolism. This antagonizes